forward to welcoming you to our hospital's international courses.
We are delighted to launch the first international educational program series at Imam Reza General Hospital, Tabriz, Iran.
Tabriz is a historical and vibrant city.
You will love our beloved city.
Join us for our educational programs.
We'd love to have you here.
Waiting for nice days together.
See you soon!
Hello everybody, ladies and gentlemen, dear colleagues. I'm pleased to start another conversation in a series of our dialogues with the professors of this hospital, Imam Reza Hospital in Tabriz. This is a rainy day in Tabriz and we are approaching Nowruz, Iranian New Year, and hope you very good days in the future. I am pleased to host Dr. Hossein Ghasemi today, one of the professors, faculty members of this university, and we are going to talk about him and the course he has provided as an international course. Very happy to have you here, Dr. Ghasemi. Would you please introduce yourself?
Thank you very much for inviting me to this program. I'm very honored to participate in this program. My name is Dr. Hossein Ghasemi. I am specialist in internal medicine. My subspecialty is in hematology and oncology and bone marrow transplantation and fellowship in cell therapy in France. And as you know, I'm the head of Department of Clinical Regenerative Medicine and the head of the clinical member of the stem cell therapy and, as you know, regenerative medicine in northwest of Iran. So our course is about the regenerative medicine, but as you know, subsided in cell therapy in mesenchymal stem cell applications in clinics.
Very good. The terms are quite new, Dr. Ghasemi. I think it needs a little bit clarification. What is regenerative medicine talking about and what is cell therapy? Would you please explain a little bit more?
Yes, as you know, the regenerative medicine is the science which we can say come from 2000. It's come from 2000, and after that, as you know, the science thought that the drugs which we use in clinics, they have many side effects. So they know that the drugs work with the cells, which are interactions with the cells which act in, as you know, intercellular communications and everything which the drugs do in our body. They help from the cells and they act on cells. So in this field, regenerative medicine, which consists of three topics: cell therapy, gene therapy, and tissue engineering. So in cell therapy, which we are a specialist in, and our team, so we use the stem cells to heal the problems of the body, any problems in any fields of the medicine.
Okay. And would you explain a little bit about mesenchymal cells, what they do exactly, and how you can use the potentials of mesenchymal stem cells for treatment?
As you know, in cell therapy field, So we have many cells which we use in treating the diseases. For example, NK cells in cancer disease, dendritic cells in cancer disease and degenerative disorders. So we have another cells which name the mesenchymal stem cells, as you know, but the newest name is medicinal signaling cells. These stem cells are stated in all parts of our body, in any organs. So they do in regeneration. You know that the Dr. Suleymanzade, which is seated here, is not the Dr. Suleyman from the 1 month ago. You fully regenerated in these 1 month. So the regeneration, as you know, time and regeneration, as you know, speed is different in our organs. For example, in cells of skins, for example, a couple of days. But in the heart muscles, maybe a couple of months. And in the brain is a couple of, maybe more than a couple of months, maybe 6 months or more. So, but because of the senescing of these stem cells in our body, for example, from the childhood until adulthood and the older people, they are making senescing, and it means that regeneration time, doubling time in, for example, in childhood is very, very faster than from the adulthood or the older patients or older humans. So, but in this field, we use these stem cells to regenerate and other aspects of disease. For example, specifically in mesenchymal stem cells. Mesenchymal stem cells, as you know, they have ability to regenerate. They have ability to immunomodulate. They have ability to, as you know, not suppress modulation of the immune cells and as you know, renewal and differentiate to other cells. So mesenchymal stem cells are multipotent cells. As you know, we use these cells and their secretomes and exosomes to, as you know, to heal and to, as you know, treat the diseases.
Okay, very good. Interesting and exciting indeed. I would like to ask about the course now. The title of the course, the content, the duration, any additional explanation about the course itself?
As you know, we made this course in Iran. As you know, maybe I can say the first university in Middle East. As you know, in Middle East, and the ninth university in the world which have clinical regenerative medicine. In Ministry of Health, we are approaching this field, as you know, for the other students, as the other physicians which they want to approach this system. But in this field, which we have fellowship, it's 4 months. Our residency or fellowship program is 4 months. Yeah, it's 4 months because we just select one topics of this field. All the fields are more than 2 years. Our as you know, fellowship took long, more than, as you know, 2 years. But in this field, the application of mesenchymal stem cells in clinics is 4 months. In 4 months, we have, as you know, physicians, their basic science are not high. Their basic science is not more, so they should learn about the basic science of the cells. So about 1.5 or 2 months our fields are about the basic science. What's the cells, what's the immune cells, about the killing rooms, as you know, what's the killing rooms, and how to culture cells, how to, as you know, use the condition mediums, how to use medium in culturing cells, and what's the regulatories, what's the, as you know, considerations about the moral implications of these cells, and they're utilizing in the clinics, and the other things in the clinics. For example, in clinics, what's the pre-medication for using these cells? How to use these cells in the various disorders, in various, for example, the utilizing cells in orthopedic, it's different from the urologic, as you know, fields, different from the, as you know, oncology, or as you know, in eye disorders. So every field is different, and the professors which we use from their, as you know, specialty in this field is different. So 2 months basic science, 2 months in clinic, and as you know, we teach these physicians, and they learn about the using stem cells, mesenchymal stem cells, their secretomes, their exosomes, how much cells, how much, as you know, exosomes, how many vesicles which they want to use in any, as you know, disorders. So how to approaching these cells to the damaged organ, as you know, about the renewation, about the, as you know, reverse aging. As you know, in this field, one of the main, as you know, and the very exciting topic is the reverse aging. And yeah, this reverse aging, what reverse aging is not using in this 4 months field, but the reversing is using in this whole, as you know, our course. So any physicians in any fields, not important, general physician, specialties or subspecialties, never mind, if they want to use mesenchymal stem cells in their fields, okay, they can come here and learn about these applications. So we teach them the whole, not the concisely everything, the whole topics of these, as you know, these sciences. So we have 2 months basic science, 2 months clinics.
Very good. And as you described, the eligibility criteria contains just being a physician, possibly.
Physicians or dentists.
Dentists.
Yeah, dentist. Physician or dentist. You know that this transformative era of medicine, this field, regenerative medicine, is the transformative era of medicine. So in this medicine, which is the future of medicine, it's about the interaction between cells and genes and the tissue engineering. Nowadays, which we are talking about this field, you have seen in science fiction movies about for example, someone cut his hand, okay, they put it in the, as you know, put it in the one, as you know, lake, which you can see in the movies, which they regenerate the cell, as you know, whole hands.
Immediately,
yes.
Everything's okay.
Yeah. Nowadays, we have this, not in Iran. Our team in Switzerland, as when they do this, they're working on this. So that's very interesting topic in the world, and the new topics in the world, which all the countries are working very hardly. So I want any physicians in the world, and as in our hospital or university, I want them come to this field and work in this field. The future of medicine is the drug-free medicine. In the future, you never took any drugs, and all of the things are the target therapy and the cell therapy and gene therapy. You know that we have gene therapy drugs in our, as you know, medicine, which they cost more than $4 million. Each vaccine is more than $4 million, but they heal the whole, as you know, disease just by one, as you know, gene editing viruses.
Oh, very exciting. And you talked about the movies. We remember the famous movie Benjamin Button, and you talked about reverse aging. I remember that. Yes. It is even.
But it's true. It's totally true, and we are working on it. Our team, we have an international team from France, Switzerland, US, as you know, and Iran. We are working on this field, reverse aging. But it's as you know, the first steps. We are in the first steps. We have many steps to achieving that, But as you know, approaching this system and standing in this line, okay, you can go and receive and that, as you know, topic, and that, as you know, thing.
I'm so proud of having you here and so excited indeed. Thank you for coming here and being with us. This was our lovely conversation with Dr. Ghasemi, and I would request you, if you have any additional questions or unclear part, you can just contact our team or visit our website for further information about the course and other similar courses. Thank you for watching.